Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and medicine. This is Nip Talk, and today we got some great topics for you. First off, what are the most dangerous medical emergencies? We're going to talk about those. Also, what are the damaging effects that the sun does to our skin? We're going to find out. And finally, the TikTok surgeon finds out her fate. What happened? Tune in right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer, Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the great Sarah. How are you today, Sarah? On the white couch. I like when they bring the couch out. It looks it's impressive. I like that. Is it more comfortable than the chair?
Kind of.
A little bit, yeah. In the box, we got Trailvis. Welcome back, and happy belated birthday. I heard it was your birthday last week.
I appreciate that.
Yeah?
I appreciate it. Yeah, it was my birthday.
Did you do anything exciting, or?
I went to Drake's, and I got one of those Drake's Hollywood out off of Lovers, and I got one of those cakes with the, what do you call it, the flares in it. It's not a flare, but.
Like a sparkler?
Yeah, a sparkler, that's it.
Nice, man. All right.
Yeah,
so you had a good birthday?
I did. I had a really good birthday, and I went to the gun range. So, yeah.
You like to go shooting?
Oh, well, I love it. I
did not know that, dude.
Yeah,
We'll have to. Where do you go? Where do you go? Somewhere around here?
So I go in Garland. It's a spot called Target Master.
Dude, you and I have to go. We've never talked about this, but
Absolutely.
like I grew up like shooting guns as a kid, and so I have like I could arm like a militia.
Really?
Yeah, I could. And I don't shoot all the time, but I really do enjoy it, man. Dude, we should go sometime.
Let's do it.
Yeah, my wife's dad, my father-in-law, who my dad passed away a long time ago, so my father-in-law is kind of like my dad now. He's a gunsmith.
Oh, wow.
And so he builds these custom guns, and anytime they come up for vacation, he always brings one. He's like, "Hey, I got this thing.
Is he the one that had the cannon in his yard?
No, that was my sister.
Oh.
Yeah, that was my sister that has the cannon. So, but yeah, dude, we'll have to go sometime. That'd be awesome. I have a membership. It's kind of far away, but we could meet somewhere and go.
Absolutely.
What about you, Sarah? You want to join us? Like I
have one gun.
A Nip Talk gun day? That just sounds bad.
I've shot a lot of them, but I only own one.
Really?
Yeah.
Well, it's good to have something for protection, you know.
Facts.
I just enjoy. I'm not like a huge hunter, although I did when I was a kid. But I just like going out and just like shooting targets, like paper, or like the clay targets, like for shotguns and stuff. I really enjoy it. It's kind of fun,
Yeah, it is. It's very therapeutic, kind of relaxing.
It is. It's kind of like you release the stress or whatever. So now
it makes me anxious.
It makes you anxious?
Yeah.
I get it. Being serious, they are very dangerous weapons, and so you have to be super careful. And I don't know. Growing up around here in Texas, at least where I grew up, it was just kind of how we grew up. Shooting, hunting, and all that stuff. Trailvis, I learned something new about you every time we do a show, man. We're definitely going to have to go out and go to the range sometime.
You got to set it up. Let's do it.
Yeah, for real. Like, I'm being serious. We're going to go. It'll be fun.
I love going.
Sarah, you want to come?
Yeah, sure.
That would be cool. Okay.
I think I probably only shoot once a year.
Really? Okay, we'll definitely do that. All right, I'll sort that out.
You have to teach me how to shoot my own gun again.
Before we jump into the segments, I have to admit that I missed Madonna's announcement. We've been talking about
saw it.
Madonna's every week. Now, Trailvis, I think you know about it, right? All right, so what did she say? Did she say anything specific?
So there was like a long statement that she released. She basically thanked everybody for their support.
Okay.
And she didn't really give like super detail, I don't think, about like what exactly it was.
What happened?
Yeah, what exactly it was. But she said that she felt better, and when she did actually like go into the hospital, two things she thought about, I think, was her kids for one, and then the other thing was refunding people their money back.
So did she say they canceled the tour? Or?
I don't think they canceled it. They may have postponed it. Yeah, they may have postponed it, but I don't think they've canceled it officially just yet.
Okay, but she didn't mention like what happened or anything like that?
No, she wasn't very like specific on it at least.
Dude, I have to say that I think probably the overdose thing is probably, because if it was like a bacterial infection, you'd probably be like, oh yeah, whatever, got sick from this bacteria. But if they don't say anything,
trying to like hush it.
Yeah, right. They just kind of gloss over it.
Thank you. Bye.
Yeah, thanks everybody. I'll see you next time, next tour. But well, I wish her the best.
Silly celebrity things.
Right. I wish her the best, and hope she's truly okay. But that's interesting. It's pretty wild, canceling a major tour like that over some unknown.
People get real mad too, because I could see why, especially if you bought plane tickets, you had a hotel set up already.
Oh, sure. Yeah.
All of that stuff. I wonder, it's you can't get your flights refunded.
I don't know. Yeah, I guess we'll see what happens. I wonder, it'll be curious to see if it's postponed forever or 6 months, a year. I don't know. Crazy.
I hope not for her, because then that means something really bad.
I know. I hope she does all right. I do love Madonna. I feel bad that we talk about her, but she's in the news and she's plastic surgery related.
She wants us to talk about her.
She does. She probably does want us to talk about her. Probably not in the way that we're always talking about her, but no such thing as bad publicity, right?
Nope.
So. All right, well, let's roll into some segments. So I don't know if you saw, Sarah. I kind of keep track of which one of our videos are popular. We had a really popular video the other day. It was the one about the world's most the most dangerous surgeries out there.
Oh yeah.
Yeah, people are eating that one up.
Nice.
And so it is kind of interesting. And so I wanted to do a similar topic because why? Well, that one was pretty popular. So I thought let's roll into something that also might be interesting. So today we're going to talk about the most dangerous medical emergencies.
Okay.
And so I have a list of 10 things that would be considered medical emergencies, and I didn't include trauma. So there's nothing in here like I got shot or I stabbed myself in the neck with a ice pick or whatever. These are medical.
You did it to yourself.
Well, whatever. These are medical emergencies. So non-traumatic type things.
Yes.
And so I made a list of top 10 things that are considered to be pretty dangerous events. And so, I don't know, do you guys want me to quiz you or just want me to talk about it? What do you guys feel like doing today?
Can we guess?
Yeah, sure.
And then you can tell us if it's on there, what it's ranked at.
You want to guess some?
Yeah.
That'd be fun. Well, yeah, okay, so, all right. All right, so what do you think are some, Sarah?
Heart attack.
That is on there, that's definitely on there.
Whatever.
Do you think that one's really, so I rank these these top 10 from least deadly to most deadly. And of course, even the least deadly is still dangerous. So you think heart attacks?
I think it's up there.
Huh?
I think it's up there.
It is on the list. I wouldn't say it's at the very top.
Oh,
So-
6.
Huh?
Is it number 6?
No.
Oh.
I have these in reverse order because I obviously didn't think about this because I have number 1 being the least. So this was my number 3. What else do you think's on there? That's good. You're absolutely right.
Stroke.
Yeah, good. Man, nailed it. That's 2 of the 10.
Yeah, that's cardiovascular.
I bet if you sat here, you could probably get over half of these.
Anything else with your brain, like an aneurysm or something?
So normally aneurysms would result in stroke.
Yeah.
That's because it'll be a bleed. Yeah, but you're right. Yeah, that's right. So.
I don't know.
You're doing great. I'm proud of you. A lot of people.
Because I'm trying not to think about things that are trauma that can just
I
happen
didn't
in
include
your body.
car crash or my parachute didn't open or whatever. These are more medical.
Some type of an obstruction.
Yeah. So perfect bowel perforation. Yeah, good. Man, you're killing it. All right, so I'm going to roll into these. All right, so on the list here at number 10, I have anaphylaxis. So you guys familiar with anaphylaxis?
I've heard of it. I think I remember what it is.
So anaphylaxis is basically the worst type of allergic reaction that you can have.
When your throat closes or something?
That's exactly right. Yeah, that's one of the things. Your airway can shut off. And so
have an EpiPen.
The one thing about anaphylaxis you have to remember is that you have to have a second exposure to the event. So for example, if you were to have an anaphylaxis reaction to a bee sting, you'd have to be stung by a bee first. Your body then creates these protectors against bee stings. What happens is when that thing re-happens to you again, your body overreacts, and that's how that you get into trouble with this. And so, actually, to be honest, I didn't remember what the risk of death for anaphylaxis was. I know it's not insignificant, but it's not super high. So the risk of death from anaphylaxis is 1 to 2%. So if you have an anaphylactic reaction, there's a 1 to 2% chance that you're going to die. And the other thing that I looked at with these dangerous medical emergencies is how common are they, right?
Yeah.
So how many people go into anaphylaxis every year? And so for anaphylaxis, it ranges from 50 to 100,000 people per year in the United States that have an anaphylactic reaction. So that accounts for about 1,000 deaths a year from anaphylaxis.
I think it happened to me when I was a kid.
From what?
Fire ants, anything that has a sting. My sisters put me outside to play, and
So you live in Texas, but you're deadly allergic to fire ants?
I was when I was a kid.
Oh, but you're not anymore?
No.
Okay, that's
So
good.
my mom used to have to carry an EpiPen around.
Really?
Like I was allergic
Yeah.
to, they found out I was allergic to like fire ants, like any type of
Stinging
bug that like
insect.
had like some type of, you know, venom in it.
Yeah.
Yeah.
Dude, fire ants are the worst. I hate fire ants so much.
Yeah.
I remember when I played football. I grew up here playing football in Texas, and the fire ants would like make mounds on the field, and you get tackled into like a mound of fire ants, and like people be on top of you, like, no, the fire ants are getting me.
Well, and you don't feel them until it's too late.
Oh, right, yeah. So next on the list is one that you hear about a lot, and that's pneumonia.
Yeah.
So you guys are familiar with pneumonia, right?
Yes.
Yeah, absolutely.
So there's a few different types of pneumonia. There's bacterial, and then there's like viral pneumonias. And of course, the bacterial tend to be the worst. You know, COVID pneumonia, that would be a viral one. Typically, that's not as dangerous. So pneumonia is definitely a little bit more dangerous. The risk of death from that overall is about 5%. Now, of course, there are certain people who are more at risk. That would be, elderly people or really young people. But the thing is that there are a ton of pneumonia cases every year. There's about 1 million cases of pneumonia every year. So you're looking at about 50,000 deaths per year from pneumonia. Next on the list is yours. So this is number 8, I guess, heart attack.
Okay.
So lots of heart attacks every year, a little less than pneumonia. There's about 800,000 people that have heart attacks every year. Of those, I think 600,000 are first heart attacks, 200,000 are repeat heart attacks. And the risk of death from that, about 12%.
Yeah.
So that's actually a little lower than I thought. I would have guessed it would be around 20%, maybe, just kind of ballparking it. That means roughly it's like a 1 in 9 chance of dying from a heart attack. That's good. It means if you have a heart attack, there's definitely a high chance that you could survive it. So next is one that I always heard about this when we were talking about going to college, and that's meningitis. You guys familiar with meningitis?
Yes.
So meningitis is basically an inflammation of the brain or spinal cord membranes, and most of the time that's due to an infection. And once again, like pneumonia, it can be from bacteria or viral, and the bacteria is much more dangerous. So risk from death of bacterial meningitis is 15 to 20%. Pretty high. Viral is a little bit lower, 1 to 10%. Now the good thing about meningitis is it's pretty rare.
Yeah.
So although it can be very, very dangerous or deadly, there's only about 500.
Isn't there like a vaccine for viral?
There is, yeah. Look, God, you should just go to med school.
I would have a health degree.
Oh, that's right. I forgot. I forgot. You wear so many hats. I forget. Yeah, very good.
I took a lot of classes to go to PA school, but I never went.
Yeah. No, it's never too late. So there's about 500 to 1,000 cases of meningitis every year. All right. Next, the one that you named, stroke. So stroke is very common as well. There's 800,000 stroke episodes every year. So pretty big number. As I was mentioning earlier, there are 2 types of stroke. There's clots, so occlusive stroke, meaning a blood vessel gets blocked by a blood clot. And then there's bleeds, which is the one that you were kind of alluding to with an aneurysm or a abnormal blood vessel that ruptures. Now, the risk of death of stroke is there's two measurements. Most people measure, what's the risk of death in the immediate time frame, so like in the first few weeks, and then what's the risk of death in a year? So risk of death in the immediate time frame is 12%, but if you extrapolate that out to a year, it's about 25%. So strokes are pretty dangerous. Definitely something that you want to keep track of your cholesterol, which also that goes along with heart attacks, which, by the way, I just had my blood tested because I had to get some life insurance, and my cholesterol's good.
Good.
I'm getting older, so, you can't just assume it's going to be good.
Yeah, high blood pressure and
that's right.
All of that runs in my family.
Oh, really? You need to stay on top of it then.
Yeah.
So strokes are, number 6. So number 5, aortic dissection. So you guys have heard of the aorta? Okay, so the aorta is the major blood vessel that comes out of your heart. And so a dissection is when the blood flow gets into the walls of the blood vessel. Okay. So it's not flowing through, like imagine like a garden hose, and if we get into like the layers that make the wall of the hose, then the water, or in this case blood, is not flowing where it should be. And what happens is when that blood flow gets into the wall, it can actually occlude the whole artery. Yeah. So these are very, and you know who died of this was, who's the guy from Three's Company, Jack Tripper? What's his real name? Jack Tripper.
I know who you're talking about. I think we talked about this one time.
I think we did. Anyway, Jack Tripper, I hate that I can't remember his name. I'll remember in a minute. He died of aortic dissection. Yeah. That's really bugging me. I can't remember his name.
Just watch the other video. I'm pretty sure we talked about it last week.
Yeah.
I swear we did.
Oh my God, I'll come to it.
John Ritter.
Yeah.
Ritter,
Yeah,
that's right.
John Ritter.
Thank you, Trailvis. Thank you. I was like flailing. I was like,
Yeah.
Trailvis, help.
I was trying to figure it out myself.
Thanks, dude.
John Ritter.
Thanks, man.
Got you.
So yeah, John Ritter died of aortic dissection. So if you have an aortic dissection, your risk of death is 30%. It's pretty high. I mean, that's like.
It sounds very serious.
It does sound right. Your blood vessels are suddenly not flowing
your
in the right
major
direction.
artery.
So fortunately, there's not a ton of aortic dissections every year. About 10,000. So you're looking around 3,000 deaths. Number 4, bowel perforation. So you were kind of talking about that. We were talking about obstruction, which can lead to bowel perforations.
Yeah.
Other thing that can lead to bowel perforations are things like ulcers. Like if you get a bad ulcer, like in your stomach, or if you get diverticulitis.
Somebody was found out that was why they died.
Lisa Marie Presley.
Yeah.
You were exactly right. She had a bowel obstruction.
Yeah.
And I assume that she perforated. I saw that. Yeah. We're on top of things. Like
I know.
We're very news. We know a lot about the news. We should be proud of ourselves.
We know things.
We know things on this show.
Hey, actually, also too, one of the viewers actually chimed in and said it. Timberline. I know I probably killed that name, but they asked if they talk about Lisa Marie Presley.
Yeah.
So they just had actually mentioned it.
That's exactly right. I saw that. They just came out that I actually had forgotten that she died. I when I saw it, I was like, oh yeah, I forgot she died. And
yeah,
then of course,
they just announced like what she died
and I hate to say this, anytime
today.
a celebrity dies, I'm always like, it was a drug overdose, which is terrible. And I just I know that she'd had some issues in the past, so I just kind of thought that. But yeah, she died of bowel perforation. And further, the reason she had a bowel obstruction was she'd had weight loss surgery. And so when you have intra-abdominal surgeries, it increases the risk that you have a bowel obstruction down the road.
What is the obstruction?
So
Food,
what happens
is
when you go into the abdomen and you start doing work, when you leave, like scar tissue forms, and so instead of everything being kind of free and mobile in there, you get these bands of scar, and the intestines will like loop over them, almost like a garden hose looping over on itself and making a kink.
Oh.
And then that makes the obstruction, and then if it's not relieved, it can rupture, or the bowel can even die. You can get necrotic bowel or intestines, so that's really bad. So bowel perforation.
Painful.
Thank you. And who is that person, Trailvis? Somebody we know?
So his name is Timber Bannon, I think is how you pronounce it.
Okay. Well, thank you so much for
Tim
chiming.
Bannon.
Thank you so much for chiming in there, Tim. So bowel. Yeah, I like to say thank you for chiming in. Risk of bowel perforation death 30%.
Yeah.
Yeah, pretty high. And there's actually a fair number of bowel perforations in the United States every year, around 50,000. So you're talking about.
Can you get a bowel obstruction from like after you have a C-section if they don't put your stuff back in correctly?
You could. I mean, it's less likely because you're down so low, right? And so on a C-section, the incision's very low, and basically the first thing that you see when you enter into the abdominal cavity is the uterus. So you're not really getting into like all the intestines as much as if you're doing something like a weight loss surgery.
Okay.
So there's not a lot of.
I was just thinking about that because I remember my daughter's dad telling me that they were just like pulling stuff out of me. And I was like, what?
It's very graphic. I mean, I was like, okay, yeah. No, I mean, typically when you're doing a C-section, I've actually done a few C-sections back forever ago. Yeah, you open up the bottom, like this uterus is right there, you get the baby out, but then, you're getting clot and stuff out, and I mean, that's probably more with,
what
placental
he was
stuff.
probably seeing.
Placenta, is what they're pulling out, not necessarily your intestines. So, but that's good. I like that. It's very graphic. Thank you. Okay, so moving on to the top 3 now. All right, so these are the top 3 most dangerous medical emergencies. Septic shock.
Okay.
So sepsis is a infection that gets in your blood, and I did go specifically for septic shock. So the difference in sepsis and septic shock. So sepsis is when you get a blood infection. Septic shock is when it's bad enough that it starts to affect your other body organs.
Yeah, so something starts shutting down.
Things start shutting down. So the risk of death from septic shock is 35%. So we're getting up there. And the total number of patients that have any type of shock in the United States, huge number, 1.7 million people. And roughly, there's about 270,000 deaths.
I wonder if that's like an age thing or like a.
For sure, like older you get, the more risky it is. Yeah, absolutely. I mean, the younger you are, the healthier you are, the more likely you're going to bounce back from one of these, bad things. So, okay, number 2 is cardiac arrest. So your heart stops beating. And that could be from a lot of things. One of the most common reasons that people's heart stops beating is they get into like a malignant rhythm, like some sort of, like the way the heart beats gets irregular and it causes them to go into cardiac arrest. It could be from like a blow to the chest. There was that football player whose name I'll never remember. That
Yes.
Trailvis, you probably know. You know about sports.
It was Lamar Hamlin, I believe.
That's right. Yeah. He took a blow to the chest, caused cardiac arrest. It could be from things like a heart attack. So there's a little bit of overlap here. But cardiac arrest is really bad. If your heart stops, you're in big trouble. Even if you get treatment, risk of death 75%.
That's what happened to my dad.
Your dad died of cardiac arrest?
Like 4 years ago.
Oh my gosh, I didn't know that. I'm so sorry.
No, it's cool.
Sorry to hear that.
It's like very rampant in my family. His brother died of a cardiac arrest as well.
You got to go, make sure you go see a cardiologist and get on top of that. I'm going to make you go to the doctor.
I have my blood pressure's always been high.
You have got to go to the doctor, Sarah. You can't be like dying here on stage.
I promise I will.
Give medical care or something. Okay, so number of cardiac arrests annually, 350 to 400,000. So that's a pretty big number.
Yeah.
Okay, number one, most dangerous, most deadly medical emergency. Anyone have any idea?
Asthma attack.
No, that's not a bad guess. No, that's not on there. It would be hard for you guys to get this. This is kind of an obscure one. So it's a rupture of a aortic aneurysm.
So another aorta.
Another aorta thing. So what that means is, as that giant blood vessel goes down, if it gets plaque buildup, it becomes a weak spot. And just like if you air a tire up too much, and have you ever seen a tire get like this kind of bulge on it?
Maybe like
a bike tire.
Yeah, a bike one. Yeah.
Yeah. Okay. So that would be a aneurysm if it was on a blood vessel, and so that makes a weak spot. And this is your major blood vessel, and if that thing ruptures, you are in trouble. So risk of death from an aortic aneurysm rupture is 80%.
I wonder how that happens. Is that just like poor health or genetic?
It's usually related to cholesterol buildup.
Okay.
You get cholesterols in your blood vessels, and then that makes a weak spot. And then if you have high blood pressure as well, it causes that area to kind of bulge out, So almost like if you have a tire that has a defect and you air it up too much, because like think of putting too much air as high blood pressure, then it goes and it makes a thing. And if you keep going, it pops. And when these pop, it's extremely deadly. So fortunately, it's not super common. It's not common as like a stroke or heart attack. There's about 20,000 episodes of this per year, but that means about 16,000 people die. So those are the top 10 most dangerous medical emergencies, of which I want to have 0 of these in my lifetime, I'm hoping.
2 of them run in my family. Or heart attack, cardiac arrest, and stroke.
I'm going to make you go to the doctor.
I've been to the doctor.
All right, good. Would you tell them all these things?
Yeah.
All right, good. Well, it's important. Got it. I'm the worst. I've actually started going to the doctor more often.
Well, girls, I feel like it's more, girls go to the doctor, I think, more than boys
And girls
do.
are much more responsible than guys.
Yeah.
Yeah.
Trailvis,
you go to the doctor?
Mm-hmm. I do.
Oh, good. All right, good. Very good.
You go to get like your annual exam and all that stuff.
Yeah, I don't ever do that. I'm bad, but I'm getting better.
Yeah, telling me to go to the doctor.
I know, right? Doctor, heal thyself. Okay, let me know what you think about those medical emergencies. If I missed one or you want to hear about a different one, leave a comment and we'll talk about it. Yep. So, okay, moving on. It's been blazing hot lately. Like if you go outside, you melt. I don't know if you guys know, Texas is in kind of a heat wave. I think it was like 106 or something yesterday.
Yeah, there was like a picture of the map and it was like top hottest places on earth, and it was like Texas and then there was like all these other places, and I was like, of course.
Surface of the sun, Dallas, Texas, the desert.
So
with the summer in full swing, and for all our friends who are watching in places where the sun is very intense, I wanted to talk about some of the negative effects of the sun on the skin. And we talked about skin cancer. This is going to be a little bit deeper.
Yeah, I think we talked about like sunscreen.
Yeah, we were talking about skin cancer. And so skin cancer and the sun do kind of go hand in hand, but I wanted to take a little bit deeper dive. And I have to thank my wife for this, and the reason I came up with this topic is because the actress Gwyneth Paltrow, who I'm sure you guys have heard her, she posted on Instagram, and she posted this picture of her, and she was at the beach, and like the internet went crazy. Like the comments was all about, oh my gosh, what happened to your skin? So Trailvis, throw that picture up, that first one, yeah. And I don't know, it might be hard for you guys to see on the screen back there, but what people were looking at was like her skin and how it looks like it's aged, and she's got the dark spots, and she's got like these wrinkles. And so, people are used to seeing Gwyneth Paltrow, in the movies all made up, and so like the internet went wild. And so, and I'm not like trying to harp on Gwyneth Paltrow. I love her. She's a great actress, very successful and all that. But in the picture, there definitely is some signs of sun exposure to her skin. So I want to do a little segment on what exactly are the negative things that the sun does to our skin.
Yeah.
So the first would be premature photoaging. This is related to the ultraviolet light effects on the skin. And I have a little zoom in picture. Can you throw that next one up, Trailvis, there if you could? Yeah. So you see how her skin, it almost looks kind of dry, almost looks kind of leathery. There's the dark spots. You can notice she's got, got some noticeable wrinkles. These are all kind of classic appearances of photoaging. So, without doubt, if you get a lot of sun exposure, and this is something that you do year after year, it is going to age you. I mean, there is no doubt whatsoever. Some of it is genetic. Some people do have a little bit more protection from that than others, but everyone's going to take some effect. Also, the darker your skin tone is, the more protection you get. So people who are more fair versus more dark-skinned are going to be at bigger risk.
Yeah, my skin's always been pretty olivey color.
Yeah, you have a good tone. Yeah, I'm a little bit more pasty than you. So
yeah, she looks like she's deaf. She does not have a top on. Just so we can throw that out there.
She doesn't have a what?
She doesn't have a top on.
She doesn't?
No,
she does.
She's
That's
topless.
a big look.
That is not her bikini. That is the sun. That's her tan.
It's her tan line. You can
She's out there. She's out there sunbathing.
Yeah.
Oh
topless.
my gosh, you're right. I didn't even notice that.
That's probably why she posted the picture to be like, ooh.
Risque, yeah.
Yeah.
Interesting. That's
Not.
a good pickup.
Hey, I look like I have skin
I
cancer.
assume that white area on her skin was her. Was
no,
a white
that's her tan line.
Oh my gosh, that's why you're here. Point out the things that I missed. All right, next up, actinic keratoses. Okay, so actinic keratoses, and I do have a picture, Trailvis, if you want to throw that up. These are basically scaly, patchy areas of sun damage that are precancerous. And so I see these come through my office. They can be a little bit worrisome for looking like skin cancers, and to be fair, they are precancers. If they're not dealt with, they can convert into squamous cell cancer. So this is a direct effect of ultraviolet radiation exposure to your skin. Of course, the more you get, the more likely you are to have them. So something you definitely want to watch out for if you are exposed to the sun a lot or have a long history of that. So next is the hyperpigmentation. This is sometimes called sunspots, liver spots, age spots. I got just a random, I mean, we could look at Paltrow again, but these are the same things.
Yeah.
And these are pretty common, in fact. Like, I've noticed I got a couple of these on myself. I think my wife's got a couple of them. I mean, this is something you can get pretty early. These are just kind of darkened pigmentations that come up from the sun. It is kind of a sign of aging. And actually, you can get rid of these. Like, some of the intense pulse lights can get rid of these. Mm-hmm. And I guess we can talk about the end some of the things you can do to prevent these things. So next thing is sunburn. We're all familiar with sunburn. It's where you basically get a true burn to your skin. It definitely is worse for your skin to get sunburns. There's a lot of studies out there show that repeated sunburns dramatically increase your risk of skin cancer, including melanoma, which is the really, really bad one. And
so, the bad one.
That's the one you don't want to get, right? So moving on, skin cancers. And we talked about this, like, I think a month or two ago when summer was starting to kick off. I have a little picture there that's like the 3 skin cancers that you can see. Basal cell tends to be kind of waxy, flesh-colored nodules. Squamous cell tends to be more like a wound, almost like the actinic keratoses, but worse. The kind of classic thing for squamous cell cancer is a spot on your skin that makes a little wound and scabs up and heals, and then repeats that process over and over.
Okay.
And then melanoma is the really bad one. Melanoma looks like a really angry, nasty-looking mole that is changing in shape or growing.
Like gross, yeah.
Yeah, so that's the one you definitely want to be super, super cautious about. Fortunately, basal cell and squamous cell very rarely get bad enough to put your life at risk, but melanoma absolutely can kill you. So if you have a mole on your body that's changing, go see a doctor. Next would be skin immune system suppression. So the more exposure, I mean, basically there's things in your skin which reverse damaged cells.
Okay.
And so that would be your immune suppression. When you get a lot of sun exposure, your body's ability, your skin's ability to fix damaged cells starts to dissipate, and that's why skin cancer becomes a risk. And then lastly, as far as one of the bad things the sun does to your skin is called solar elastosis, and I got a picture of that. The skin tends to look kind of yellowy, appears thickened or almost leathery. once again, there's a lot of kind of crossover between all these different things, but solar elastosis is something that definitely can happen with like repeated sun exposure. People are out in the sun like every day, all day for years and years.
Yeah, that's not cute.
I do like how you put the square over the eye.
Just to so actually, I pulled this off a database. So yeah, I didn't do that. It was kind of funny, right? Like it's like they needed to do something so you couldn't identify it.
We'll never figure out who that
is. Who is that person? I think that picture's like decades old, honestly. So, also one thing I would like to say is that smoking exacerbates the effects of sun damage on the skin. And someone actually mentioned on Gwyneth Paltrow's like enormous comment list that, oh, by the way, she used to be a big, heavy smoker, and that may have contributed to why her skin looks like that. And they're absolutely right. You know, if you're a smoker and you get sun exposure, it's kind of like the double whammy for having aged skin. And, you know, I have people come into my office sometimes and I can, you know, look at them. I mean, I don't like, you know, give them grief about it, but like in my mind, I'm like, oh, this person, you know, either has had a ton of sun exposure, has been a really heavy smoker, or both. And I can just tell by their skin. So, you know, as far as what to do to protect it, sunblock is the big one. You know, staying out of the sun, using sunblock, keeping hydrated, seeking shade, especially during the really kind of intense sun times, which is, you know, noon to like 4 or 5 o'clock. So yeah, I mean, it's one of those things where when you're young, you don't think about it. You're like, oh, I want to get a nice tan and look good. But it does have its effects over time, and it can really make you look more aged. And as I said, there are things you can do to your skin if it gets like that. I mean, you can zap away dark spots. You can do treatments to kind of reverse those effects. But it's always better if you don't have to do those things.
Yeah, I think I've definitely, back in the day, I would not wear that much sunscreen,
if
at all. But now I'm more cautious about it, for sure.
Yeah, you get smarter.
Especially since I have Avery, and she has a lot fairer skin than I do. I'm like, you know, is it like 2 or 3
2 hours?
hours?
That's right. 2 hours, waterproof sunblock.
And it's like anything above SPF 30 is what you're supposed to use. Like anything below that's not even really doing that much, really, right?
I mean, I would say that 30 is kind of what you really should aim for, or
I think I have 50 for Avery.
Yeah. Now, I will tell you that if I'm out in the sun and I get like a base tan, like, because the darker your skin is, the more it protects you.
Yeah.
And so as the summer goes on, if I get a little bit of a base tan, I'll kind of go from like using 30 to maybe using 20 or whatever the next step down is.
Yeah.
But yeah, I mean, the main thing is you do want to protect your skin. If you just run out there with no sunscreen on, you're going to get damage, and you're going to end up looking much older than you should when you're not that old. So
yeah, 100%.
Sun's bad for you.
Agreed. But it's also good for you.
The sun's also good. It's such a conundrum. Okay, moving on to our final segment of the day, and this is kind of a circle back on a topic that we've talked about a couple times. So you guys remember the TikTok famous surgeon, Dr. Roxy? Mm-hmm. All right, so for those who haven't seen our previous episodes about Dr. Roxy, she was a plastic surgeon who got pretty famous on TikTok. She had close to 1 million followers, and the reason she got so popular is she was live streaming her surgeries, which is kind of a controversial thing to do. Dr. Miami was kind of the first one to do it on Snapchat, and Dr. Roxy kind of took it to the next level, and she was live streaming a lot of surgeries. And what really got her in trouble is she seemed to be concentrating more on the live stream than the actual surgery.
Yeah.
And so I have a couple videos I was going to show Trailvis. Let's see, can you throw up that first video? Yeah, so you do a lot of these videos, which, I mean, that's not really dangerous for patients. I mean, they're just kind of like silly TikTok type videos, which some people were. Yeah, okay, this is the big one. So that's her doing liposuction, and she's just talking to the camera, and at times not even really looking at what she's doing. And so, and this is
that
just
in somebody's neck?
Yeah, it's just someone's neck. Yeah, and she's even talking about.
It just makes me want to like.
And she even like was talking about how dangerous it is to do liposuction on the neck because there's so many critical structures in there.
And she's just like not even looking.
Not even really looking at what she's doing. So what ended up happening is, of course, the medical board got on to her about, hey, we have some concerns about this, and they reached out to her a few times, and she kept doing it. She kept doing it. Well. Eventually, it kind of caught up with her because she had 3 patients that got really significant complications from injuries.
Specifically from like liposuction?
Yeah, specifically from liposuction. One patient, well, I think 2 of the patients got ruptured bowel. So the intestine got ruptured, which, you know, that is one of the most dangerous risks of doing liposuction is that you go too deep and you injure an internal organ.
Yeah.
Because liposuction should all be above the layer of your fascia, which is the kind of the muscular layer which separates your insides from your outsides. And so she got too deep, she punctured some intestines, patients got super sick. One patient ended up with brain damage. And these are patients that she was operating on while she was live streaming.
Wow.
And so I guess it was last year the medical board, pulled her license, and then there was this big investigation. And we talked about it a month ago because they wrapped up the investigation, and then they have like a month to decide what what are they going to do with her. So yesterday they announced it, or 2 days ago. What do you think happened?
I think they took her license away.
They did. Yeah, they gave her a permanent ban in the state of Ohio. So Dr. Roxy got banned from medicine in the state of Ohio. And that's kind of a bad thing because, the first thing you might think is, well, she can just go to another state. Well,
it's like change her name.
Yeah, I mean, you have to, when you apply for a medical license, you have to state if you've had any sanctions or anything against you. And so, unfortunately or fortunately, depending on how you want to look at it, I mean, this is going to follow her. And realistically, it's going to be hard for her to practice medicine again. And
you think that she could be like a Care Now doctor or anything like that?
You need a medical license to do that.
I know, but versus being a plastic surgeon ever again.
No, I don't. I mean, it'd be hard because you have to have that medical license to practice medicine.
Yeah.
And so the state of Ohio said she's permanently banned, and so she can't appeal it, but she didn't even say that she was going to appeal it.
She's going to keep making stupid TikToks, I guess.
I don't know. I'm not sure what she's gonna do. It's bad. I mean, I like I said, she made a huge mistake. Patients got hurt. I do feel bad for her. She was talking about how her husband had left her because of all this, and her kids are keep taking grief at school because of all this. I mean, it's just really gone bad for her, and so you do feel bad for her. But I mean,
that's intense.
Yeah. So it's crazy stuff. I don't know what she can do. There are non-medical jobs that doctors can do. I mean, things like working for an insurance company or, clinical research type.
Being like a teacher?
Yeah, I mean, that's another thing, yeah, for sure. So I kind of felt I remember last time when we talked about her, I was really felt like she probably was going to permanently lose her license. I mean, if it had been one event, you could probably say, okay, well, something bad happened and you learn from this mistake and you move on. But apparently the medical board had told her multiple times not to do this.
It's kind of hard to ignore straight up proof.
Right, yeah. It was
video.
a repeated thing where she was having these live streams and then they had concern she wasn't paying attention. And yet there was multiple people that got injured. And so, yeah, I think it was probably a fairly easy decision for the board to make that.
I think so. I immediately said it. Yeah, she got.
Yeah.
She got.
She got. So I hope that she can find some peace and find something to do. And
I'm sure she will.
Yeah, and I hope the patients are all right too. It's just sad. I mean, it's something to be learned about. For doctors really not to let that kind of social media get taken too far. It's almost like people are pushing the limits on what they're doing with live streaming. And at the end of the day, I mean, you're practicing medicine, and there are risks associated with that.
Yeah.
And you have to kind of focus on that. I've never really been big about. I briefly thought about live streaming some surgeries, and I was like, nah, I don't think I'm gonna do that.
I feel like that's too much pressure.
Yeah, I mean, I don't mind the pressure. It's just I just don't want any distractions.
Yeah.
Even when you're doing things that are pretty routine, I mean, you just don't need why. It'd be like if an airline pilot was, doing a live stream while he's flying. I mean, people would probably look down upon that. It's like, hey, man, fly the plane.
Yeah.
Get us there safe, right?
Yeah.
So, all right. Well, crazy stuff.
Yeah.
I think it's about
Any
all
good
the
news?
Think about all the time we have today. Please let us know what you want us to talk about. We'd love to hear from you. Leave us a comment, and we'll talk about what you want to hear about. See you next week on Nip Talk.